titled Maryland Medical Assistance Program Self-Measure Blood Pressure Monitoring. Delegate Bandari, good afternoon, and you can get started.
Thank you, Chair Pendergrass, Vice Chair Pena Melnick, and member colleagues of the Health and Government Operations Committee. Good afternoon. House Bill 534 would require the Maryland Medical Assistant Program to provide coverage for self-measure blood pressure monitoring beginning in 2023. This would give people with high blood pressure, also known as hypertension, the tools to take control of their own health and significantly reduce their risk of heart disease or stroke. An estimated 1.5 million adults in our state deal with hypertension, but almost half of these individuals, about 700,000, according to CDC estimate, don't have the condition under control. Everyone has their blood pressure taken by the doctor, but some people need more regular monitoring. We have the tools to do this from home, but inconsistent insurance coverage and provider reimbursement is a barrier many people face in better managing hypertension. It is also important to note the fiscal note estimated increases in Medicaid expenditure as a result of this bill do not reflect the saving, which would be associated with a healthier population relying less on treatment for more serious health outcomes. Research has shown that self measured blood pressure monitoring combined with clinical support from healthcare providers is effective in reducing hypertension, improving patient knowledge, enhancing adherence to prescribed medication, and improving the responsiveness of our healthcare systems. This bill will help so many people improve their own health and also have the peace of mind which comes with being more informed on these life and death issues. House Bill 534 would help those 1.5 million Marylanders with hypertension live healthier lives. We all know someone is struggling with hypertension. We may or may not know someone who had died from complication of the condition. We must do everything we can to avoid this outcome and stepping up our coverage through the provisions of HB 534. It is a significant step in this direction. I will also note that this bill had a Senate hearing yesterday with no opposition. To my knowledge, there is no opposition on this bill today, too. And included in written testimony are favorable reports from Medicaid, the Maryland Department of Health, and the Maryland Association of County Health Officers, and many other written testimonies based on the clinical evidences. With that, I request a favorable report from the committee. Madam Chair, Ms. Laura Hell, American Heart Association, is the first one to testify on this bill. And I would like Laura use my remaining time as well.
Thank you, Delegate Bandari. Ms. Laura Hill, you have your 2 minutes plus a minute and 46 seconds. Welcome to the committee. Will you please get started?
Thank you, Madam Chair, Madam Vice Chair, members of the committee, and thank you, Delegate Bandari, for your sponsorship of this important legislation. My name is Laura Hale. I'm the Director of Government Relations with the American Heart Association, and we extend our strong support for HB 534. We have seen, and as been stated, this legislation is really essential for our Medicaid patients, as we found that having both clinical support as well as a blood pressure device at home is really effective at reducing high blood pressure, also known as hypertension. We have seen with this as well that this really improves patient outcomes as patients truly need that support and being able to properly manage their blood pressure. The fiscal note overall, as was already noted, is we think a little high, but we hope to see a number of people take it up. But being able to have real savings between stroke as well as decreases in going to the hospital are things that we can definitely see from putting this legislation forward. I also wanted to talk as well about when we think about Medicaid, we may think of older patients at first, but I wanted to bring us most closely to our maternal and postpartum patients. I wouldn't be before you all today, as I had a little girl back in August, if I did not have support from my physicians to be able to manage my blood pressure as I developed preeclampsia and experience with that postpartum. We need to make sure that for all of our Medicaid patients, that they have the support that I was able to have, so that we have longer, healthier lives for all of those that we see. And we really wanted to make sure to bring that home today with this legislation. This really makes sense. And we know that having both the clinical support, which is outlined here, as well as blood pressure devices, that we will see wonderful patient outcomes. Thank you so much for your time today, and we urge a favorable report.
Thank you for being with us today. We appreciate your testimony. Next, we have Ms. Chanda Brown. Good afternoon, ma'am.
Good afternoon. Thank you for the opportunity to speak, Madam Chair, Vice Chair, and honored members of the committee. My name is Chanda Brown. I'm a licensed social worker and founder of Zen Lately, a small health and wellness business in Baltimore City. I'm here today in favor of House Bill 534. I've developed programs and provided services to countless Medicaid recipients in Baltimore City for nearly 20 years. And I'd like to provide a clear picture of what I encounter far too often as a direct service worker. I ask that you all imagine arriving to work and you're met with your client on the elevator with his genitals exposed, urinating, experiencing disorientation and mental confusion, being ridiculed because the behavior was presumed to be drug abuse. Upon further assessment by emergency medical technicians, you learn that his blood pressure is uncontrolled, and further conversation with him, you learn that he's really struggling to monitor it without support. He also expresses anxiety around medical bills due to ambulatory rides as a result of his hypertension. I'm here to bring awareness on his behalf and the countless others struggling to control their blood pressure, because he is unfortunately no longer with us. He succumbed to his chronic health conditions that were directly related to his hypertension. Self-measured blood pressure monitoring not only improves one's quality of life, it could potentially reduce healthcare costs and ultimately saves lives. I urge a favorable report on House Bill 534. Thank you.
Thank you so much for your testimony today, Ms. Brown. Next, we have Mr. Ethel Morgan. Ethel Morgan?
Yes, can you hear me?
Yes, we can. Good afternoon.
Good afternoon, Madam Vice Chair, Madam Chair, members of the committee. Thank you, first of all, for the opportunity to speak to you today. I'm Dr. Ethel Morgan. I'm a cardiologist. I'm a member of the board of the American Heart Association. I've been practicing cardiology in West Baltimore for more than 25 years. And I appreciate the opportunity to lend my support to House Bill 534. I came to Maryland in 1982 to attend medical school at Johns Hopkins, and I've been here ever since, and I've really appreciated that this is a wonderful state for a guy like me. High blood pressure or hypertension is often referred to as a silent killer, and for far too many of my patients, it's something they struggle with trying to get it under better control. In my years of practice and through the research literature, what I've learned is that when a patient is able to have the clinical support combined with the ability using their own home blood pressure monitor device to measure the blood pressure themselves, they're much better able to have success at monitoring and managing the blood pressure. It's a silent disease, and people are unaware of it often when their blood pressure is high. But when they can monitor it themselves and know that it's high, then they are more willing to take their medications. They need clinical support to understand these devices and to understand the measurements and the numbers they're getting, and to help them make progress towards the goals that they have set for themselves. and that their provider has set for them. I've had many patients express a completely new understanding of the problem once they're able to monitor the blood pressure themselves, get feedback from their providers about the blood pressure and how they're doing. They're more compliant with their medications when they're able to track the effects of the medications and monitor the progress they're making. If they have a provider who can help them monitor it as well, it's incredibly important. One of my patients, I become quite frustrated because her blood pressure was always high at the office. And once we had her monitoring it at home, we found that actually it was much better at home. And I told her, well, it looks like your blood pressure is not actually that high. You have this white coat hypertension. And she said, well, doctor, it appears that you're the one who's been sending up my pressure all this time. So this was really a game changer for her after years of frustration. I believe this technology is as far as blood pressure control is going, the single biggest real advance to management in my career during my time. As a physician, me and my team, we get pulled in many different directions every day. And the ability to properly catalog the time that we spend educating patients, supporting them, helping them to manage their blood pressure is essential. This legislation will allow for new codes to be turned on so that the providers can be reimbursed and can help keep track and document the support that they give to these patients. And this is going to prove to be incredibly important. So for all the reasons I mentioned above, I urge that you favorably support House Bill 534, which gives us a magnificent new tool to help the patients manage this deadly disease. I appreciate your time and your ear in listening, and please do pass this bill. Thank you.
Thank you, Doctor, for your service to the state of Maryland. We really appreciate you and for the work you do. Next, we have Ms. Christy Waterman. Ms. Waterman from the Maryland Nurses Association. Are you here?
I am. Good afternoon, everyone.
Good afternoon.
Thank you, Madam Vice Chair and committee members. I'm Christy Simon Waterman. I am a family nurse practitioner and the president of Maryland Nurses Association. I am urging you to vote in favor of House Bill 534, Maryland Medical Assistant Program Self-Measured Blood Pressure Monitoring. Monitoring blood pressure at home can save money and save lives. It saves lives because it is associated with better blood pressure control. It saves money by reducing medications as well as provider and emergency department visits. I once cared for a woman not yet 30 years old who was 37 weeks pregnant and scheduled for an office visit in 6 days. She checked her blood pressure at home, saw it was high, and came to the office where fetal distress was discovered. This patient was sent directly to the hospital where a C-section was performed. Her son was delivered with a low APGAR scores, but was successfully resuscitated. High blood pressure, also known as hypertension, is a threat to the health of many people. Treatments may not seem urgent and is easily put off by patients because hypertension does not cause immediate obvious symptoms. The American Heart Association reported high blood pressure in 6% of people aged 20 to 44, 34% of those aged 45 to 64, and 60% of those 65 and older. A study published in the Journal of Hypertension found net savings achieved with home blood pressure monitoring ranged from $33 to $166 per person in the first year. In 2020, the American Heart Association and the American Medical Association published a joint policy statement supporting self-measured blood pressure monitoring at home. The Maryland Nurses Association joins them and other healthcare providers in urging that Maryland Medicaid patients be reimbursed for blood pressure monitoring kits. Maryland nurses urge you to vote for House Bill 534. Thank you for your support.
Thank you for your testimony today and for the work you do. Are there any questions regarding House Bill 534? Just checking the participants to make sure. I see none. Thank you so much, but this will conclude the bill hearing on House Bill 534. Thank you for being with us today.